I was homeless for 6 years and I came under this team 2 years ago. If you told me 2 years ago that I'd be able to live independently, I wouldn't have believed you. Do you know, I would have told you that I couldn't do it, but I'm doing it now.
The Slí Nua team began in 2017. It was an interagency approach between Slí Nua, the principal social worker at the time, senior management in HSE social inclusion. Relationships were built with key stakeholders, Galway City Council, the Simon community and Cope Galway, and it resulted in a successful submission to the Service Reform Fund in Genio and resulted in a specialist community mental health team for people who are homeless in Galway City.
I see the team about twice, maybe 3 times a week. The support is next to none, the support is really good. So I'd have Dr. Bainbridge. She would help me if I'm not sleeping, if I'm not eating, she'd talk to me and help me with the meds. And then I'd have the support from the OT, doing stuff like learning to tie my shoelaces, going for a walk, and then the social worker would help me with skills. The best thing is probably the space, and it's nice and quiet as well. I have a sensory box as well, and we have everything in it for the 5 senses. The squishy ones, I bring these everywhere because I get really anxious, so I have loads of them in the house.
The development of this team acknowledges the prevalence of mental illness in the homeless population and the impact that has on their lives. The purpose is to ensure ease of access to mental health care and support that is sensitive to the needs of people who are homeless and experiencing mental illness. Dr. Emma Bainbridge, consultant psychiatrist, joined the team in 2019, and she works alongside social work, nursing and occupational therapy to provide specialist assertive outreach mental health care to the homeless population in Galway. The team were led by 6 guiding principles: person-centred care, trauma-informed care, recovery-orientated practice, human rights, social inclusion and harm reduction. A large part of our work is working with service users under the Housing First project. So the Housing First project emphasises secure and long-term homes for people with individualised supports to wrap around them to help them maintain their tenancy. We're now co-located with the Housing First team here in Galway, which ensures best practice in terms of interagency working. We're really grateful for the ease of communication we have and the relationships we've developed here. We'd like to thank all those who supported the development of the team, our interagency partners, and especially to the service users who have worked with us on their journey. I just feel like it's our privilege actually to do the work. We're so lucky to get to work in partnership with the City Council and the County Council, and to be able to see people move from homeless services and from institutions into their own homes, and that is, that's the best part of the work.